Hello everyone and welcome to today's webinar titled Detection of Chemical Agents in Bone by LC-HRMS. I'm Susie Valdez of Labroots and I'll be your moderator for today's event. Today's educational web seminar is sponsored by Agilent. So let's get started. Before we begin, I want to remind everyone that this event is interactive and we encourage you to participate by submitting as many questions as you have during the presentation. To do so, simply type them into the Ask a Question box and click Send. We'll answer as many questions as we have time for at the end of the presentation. If you have any trouble seeing or hearing the presentation, click on the Ask a Question box located on the far left of your screen. As a reminder, this presentation is educational and offers free continuing education credits. Click on the Continuing Education Credits tab located at the top right corner of your presentation window and follow the process to obtain your credits. Without further ado, I now present today's speaker, Dr. Timothy Garrett, an Associate Professor at University of Florida. For a complete biography on Dr. Garrett, please visit the Biography tab at the top of your screen. Dr. Garrett, you may now begin your presentation. Welcome, sir.
Well, thank you for that introduction, and thank you for the opportunity to be here to talk to you all about some research that we did at the University of Florida in the detection of chemical agents in bone by LC mass spectrometry. I want to point out that this work was done by Dr. Katie Rubin as part of her graduate work here at the University of Florida, and she led all these efforts. In a lot of the method development was done in collaboration with both forensic toxicology and forensic anthropology and pathology. So hopefully I'll give you a good overview of what we worked on and the problems behind and needs behind chemical detection in bone. So overall, the problem exists that there is a need in toxicology for the analysis of bone. Primarily what most determinations of cause of death are determined by skeletal remains, and they're usually using physical trauma or other signs that can show what might have happened during death. But there are often new cases showing up that have no physical signs of death, and thus no way to ascertain what happens in those skeletal remains. So, and analysis of bone is routinely done in a toxicology lab, and so often forensic toxicologists might bring in a forensic anthropologist to help understand what might have happened to this individual, but there's just so limited information that we can gather without digging deeper into the chemicals. There have been a new set of studies that have come out more recently that have started to look at whether or not we can measure chemicals in bones, but more experimentation is needed and more validation. There's still some issues whether or not the interoperability of the skeletal toxicology and what it means when chemicals are present or not present in bone. There's still a lot of concerns about how that might show up and how do we interpret these results, because whether they're present or not may or may not have caused the death, so we have to understand what their presence means in terms of other studies. So some of the questions that we have in this study are: how does xenobiotics, forensic and clinical interest, interact with bone? Basic questions. And we also are interested in how nerve agents could be isolated and detected from the bone matrix. And we're also interested whether or not nerve agents would be absorbed onto the bone in vivo. And so we want to design experiments to do this kind of work. It has been shown in the past that drugs and drug metabolites can be detected from fresh bone, and they've been reliably detected up to at least 15 years after death as well. Some of the issues that have been shown is that most of the exposure is really considering more acute versus chronic, and so you have higher levels of, in this case ketamine, that was found higher levels of an acute toxicity versus a chronic use. So that tells us a little bit about what might have happened. So that does give us a little bit about dose-death interval and how important that might be. And then there's also differences between the type of bone within an individual versus trabecular or cortex. That might tell us where to best sample to get the right kind of information. And overall, the best responses have been seen using trabecular bone, such as vertebrae or elements of the pelvic area. So let's talk a little bit about bone chemistry. So bone chemistry is important, of course, to understand the chemical manifestations of what happens. So bone consists of an organic matrix. That's approximately 35% solid mass, and most of that is 90% collagen. It also consists of an inorganic matrix that consists of about 65% roughly of the mass, and that contains phosphorus hydroxyapatite as well as carbonated calcium. And the carbon present increases the solubility and the substitution within the bone matrix. There's of course also water present as part of the mass, and it consists in two layers. It consists as a bulk as well as a hydrated layer, right? And so the bulk layer provides a solvent for diffusion into the matrix, into the bone, as well as transporting ions to and from the osteocytes during mineralization. While the hydrated layer is a structured surface layer that surrounds the bone crystals and constitutes a non-hepatic domain of the inorganic matrix. And it's thought that there's an exchangeable mineral as a part of this hydrated layer, but of course more research needs to be done in that. But basically we have a way to bring ions in, and we have a way to bring ions out through this process. If you want to learn more about this research, Katie Rubin wrote a recent review article discussing the state and future of skeletal toxicology, both from a humanitarian and a forensic approach to help understand where and how this would be important in the future. So getting back to the model, ions, we have a mechanism by which ions can diffuse into the matrix. And there's a gradient that exists inside the bone. And so we have an exchangeable ability to move ions in and move ions out from the serum and from as drugs go in. So drugs that are ionized by body temperature and physiological pH are most likely to be exchangeable. And even ions with potentially low affinity for bone may be exchangeable as well because of their ionic ability and their ionic charge to get into the hydrated layer. There's also been studies that have shown that the type of fluid makes a difference, as well as the exchange between ion replacement in and out of the bone. And one thing to note is that this can happen with multiple kinds of species and multiple kinds of drugs that have happened in the past. This has been seen with drugs of abuse, with like opioids, and it's also been used in other kinds of normal drugs that are taken in a normal situation. And so drug ions that are good substitutes or attracted to the bone minerals may absorb into the hard surface of the bone, into the crystal structure. And those ions may or may not be freely exchangeable, but they can fall out. Drugs may also indirectly absorb to the surface if they are complex to other compounds that are likely to be absorbed. So if they form a complex, they might be able to get in to that bone structure. If the bone surface is modeling or remodeling, absorbed ions also could be trapped permanently into the bone matrix. And this is where we're interested in this kind of concept for forensic analysis, that these trapped species wouldn't get removed in the absence of resorption, so they would stay in there for a long period of time, allowing us to potentially measure what may or may not be present in the skeletal remains. And so what we find is that most drugs of forensic interest are exchangeable, but there's a select set of toxic substances that could make them good substitutes for this mineral lattice, rendering them fully incorporated into the bone and not being pulled out or not being exchangeable over a period of time. A class of compounds that's likely to do this are organophosphates. Organophosphates represent pesticides as well as chemical nerve agents. Pesticides, of course, result in several deaths worldwide every year, approximately 250,000. And chemical weapons have been used over the years. Of course, they were developed for militaristic purposes, and they've been used in different attacks throughout the years, including in Iraq, Syria, and Japan. And so if we look a little bit at the structure of these, we have structures based on what could be present in the bone. Hydrogen phosphate is found in the hydrated layer of the bone. And so if we look more detailed in the structure, MPA, which is a common metabolite of many nerve agents, has a very similar structure with only a methyl group different between hydroxy hydrogen phosphate, which could lend itself to being incorporated into the matrix. And so we also have EMPA, IMPA, PMP, and CMPA that are other agents from either VX, sarin, or other types of nerve agents that have this similar phosphate structure, which again could lend themselves to be incorporated into bone and thus allow us to detect them later on in life to know what may or may not have happened to this individual. We also have the pyrophosphate. So pyrophosphate is one of the most common species in the bone and a bone-seeking compound. And then we also have TEP, which is triethyl pyrophosphate. And so you can sort of see that similarity with that organic pesticide, where its structure is very similar to that of pyrophosphate. And there's also a drug that's used to treat osteoporosis, zoldronic acid, which is a bisphosphonate and also could be bone-seeking. And so these are just a select few of other potential species that are present that we either might take for a clinical reason, as in osteoporosis, or that might be present in other regions for us to understand what happens to the bone and how we can analyze specific species present in the bone later on in life. So in general, phosphonates will be strong chelators, and they should absorb strongly to mineral surfaces, including these hydroxyapatites. And of course, calcium present increases this ability to absorb. And there's also been shown that MPA forms a strong complex with calcium. And so there's a reason that we could have behind this, and why bone would be and why bone would be a realistic matrix to go and look for these chemicals to help understand what might have happened during a chemical exposure. And so these are the chemical target species that we're interested in for this study primarily. And most of them are negative ions because of the phosphate structure, so they'll be ionized in a negative ion mode, and they're all metabolites of these various gases that have been used in the past. So to do this work, we centered on the use of liquid chromatography, mass spectrometry, in particular using high-resolution mass spectrometry as the starting point. And the reason we used high-resolution as the method development approach is several reasons. One, it allows us to measure our metabolites and our target species of interest using accurate mass and using the mass resolution capable on this instrument. And it also allows us to see other species that are present. And during method development, you have to understand the matrix and what is present in the matrix and how that might affect your ion suppression or might affect any other issues relating to how you can analyze your species. And having an ability to use a high-resolution platform to do that might allow us to identify other metabolites that could be interfering with our method, so that we could go back and try to pull those metabolites out with it, either by modifying the extraction mode or by modifying the chromatography to help reduce that kind of background. And you might not get that if you go directly to a triple quad, because a triple quad will only let you look at what you're looking at, which is one of the reasons why it's an amazing instrument. But in this case, starting from an unusual matrix that not many individuals have tested before, using an instrument that's capable of measuring more ions at the same time, I think is highly valuable. And so this is where we started. And after we developed the method in a QToF, we moved it to a triple quad and made a traditional selected reaction monitoring method for the quantitative performance of this assay. So it's sort of starting in a two-phase approach to do method development, optimization, and then targeted quantitation without having to do all that on one instrument. With any kind of chromatographic approach, there are often multiple ways, of course, to start and do separation. Reverse phase chromatography, or RPC, is one of the most common approaches, where you use an aqueous mobile phase, typically water, and you have a non-polar stationary phase, like a column that's a C18 column or a C8 column, and then you increase your organic gradient, maybe methanol or maybe acetonitrile, to elute the species of interest. And they'll, of course, elute based on hydrophobicity. And so the hydrophobic species will be retained on the column, while the hydrophilic species will be eluted off the column very early. And so the other option that we have is something called hilic or hydrophobic liquid interaction chromatography, which is essentially the opposite of reverse phase, where you start with a high amount of organic, typically acetonitrile or a organic that's aprotic. You have a very polar stationary phase like silica, and then you increase the amount of water in that gradient to elute in a reverse order. So in this case, the hydrophobic species would come out really early, while the hydrophilic species would be retained. And so you have to make this choice. Well, what kind of analytes we have? Well, we have very polar analytes. We have phosphonates or bisphosphonates, organophosphates that have a high polarity, right? So we might want to start with a helic approach, and indeed we did start with a helic approach for this methodology, but we found that the reproducibility of helic columns for this method were very poor, and we didn't get consistent retention times across the performance. So in the end, we decided to stick with a reverse phase approach and try to optimize the chromatography so that we can get the separation we need on a reverse phase column. And this is an example where we started with on this column using an initial separation. And while we can't separate everything out, at least we have a place to start, and we can then move to optimizing the chromatography. So we did that. We moved on to changing different components within the system. And of course, one of the key parts of this is picking the right modifiers, the right mobile phases. And you can see a list of the multiple mobile phases that were tested in this approach. Katie went through a very long list of different kinds of modifiers to see how well we could separate these ions, partly because they're very, very hydrophilic, and so separating on C18 required optimizing these approaches, right? So in general, you want to have a mobile phase that is two pKa units away from your ions, and these ions are typically have a pKa of around 2.7 or so, or 2 to 2.3, and for the most part, the top 6 mobile phases had a pH around 2 to 2.7, depending on what's measured. And so 20 millimolar ammonium acetate with or without formic acid, or even ammonium formate we tried, didn't work extremely well. We then just tried using formic acid alone, and that didn't work well. And in the end, what seemed to work extremely well was using acetic acid at 0.5%. Now, acetic acid would have a pH about 4 or so in solution, so it would still be a very good mobile phase for negative ionization. And so we have to play between the separation, but also ionization efficiency. And so by using 0.5% acetic acid, we still get a strong ionization efficiency as well as separation. You can see that with the red trace in the chromatogram. By using 0.5% acetic acid in the mobile phase A, we can get that separation. Now we can still also think about the type of water, and surprisingly, the type of water always makes a difference no matter where you are. And so if we look at LC-MS grade water versus milliQ water, I've always been on the assumption that buying bottled water or LC-MS grade water would be the best approach. But in this case, what we found is that milliQ water was actually improved our sensitivity, and that's the gray trace that you see in the chromatogram, where we get an improved sensitivity. We don't really know why we get improved sensitivity, whether it's less, we have just less cations present in the negative ion mode that might make a difference, or less background interference. We don't know yet, but in the end, milliQ water tends to perform better. So testing your water is a very important part of this process. So then the sort of final step in this is adjusting the mobile phase for part B. So methanol is what mobile phase we settled on because it improved the best sensitivity versus acetonitrile. But we wanted to try whether a modifier in that made a difference. And in the end, what we found is that no modifier made the most difference, most sensitivity and most separation, and that's the red trace you can see at the bottom, where we still get excellent separation of these highly polar analytes. So remember that these are very highly polar, but we have excellent separation across the chromatogram and very strong sensitivity. And we pull out and tease out some of these later eluting species without that. With just methanol. And here you can see the gradient that we employed for this method. And in the end, it tended to work fairly well. And it's a roughly 10-minute method with about 5 minutes needed for equilibration at the end. And so fairly fast method, but and able to separate about 8 compounds within that mode. So a lot of work went into extraction, and I've sort of shrunk this down given the time that we have. The extraction from bone was a very highly complex approach because it's one of the more complex matrices partly because you have a lot of calcium, you have a lot of ions, you have a lot of other species that are present. You have to break the bone down. You have to pulverize it and get to fine powder, which is each bone will be different for that, and it takes an extreme amount of force to do that. And so Katie spent a good part of a year really trying to optimize the extraction procedure for this. But basically what happens is we demineralize the species, we wash it, then we add calcium to precipitate any salts as a way to get out other species that are present, other metabolites or other cations that are present to get out there. Then we wash the salt out, and then we do solid phase extraction of this material. And in this case, we're conditioning with 4 mils of 1% formic acid in methanol, and then adding HCl, loading the samples and washing it with HCl, and then eluting with 1% formic acid in methanol. And then evaporating and reconstituting in a 0.2 mils of 0.5% acetic acid, which is the mobile phase that we started with. So very polar mobile phase, and ideally you like to start your separation with the same, your analyte should be dissolved in the same mobile phase that you start with. And in this case, that worked pretty well. And so in this picture, you can see sort of the separation that we get with this type of analysis. And the big precipitate in the middle would be all that calcium and all that part of the bone that we don't want, all that precipitate that falls out. So if we look at a chromatographic trace of this work, we can see part of the reason why high resolution was important for this. I'm not showing any mass spectra at this point, but the gray trace is citrate, and citrate levels in the bone, even though we try to precipitate out, are extremely high. Citrate would be a common species that would be present in bone. And you can sort of see it's 5 to 10 times greater in soft tissue versus versus bone, but it still has a high amount of contamination. And underneath this, I'm showing the blue traces. Those are the different analytes of interest. So with citrate, it causes extreme amount of ion suppression, which is not ideal for this kind of analysis. And so we have to sort of find another approach, another way to precipitate out that. And so we did find a way to precipitate citrate out to remove some of it. And so in the orange trace is what was before, and now we have the gray trace, which is better. Still not ideal, but we're precipitating some of it out to at least help in our detection mode before we move to real samples. So what kind of suppression are we observing? So if we look at a sample of 0.5 nanograms per gram of each of these analytes and 5 nanograms per gram, we can observe that we have about 80% ion suppression for EMPA, which is our earliest eluting compound, versus about 11% ion suppression for PMPA, which is our latest eluting species. So it's generally related to elution order, and it's generally related to that citrate background then that's causing this ion suppression. Now, there's almost no way to get rid of all the citrate without precipitating out our ions of interest because of their propensity to have the same kind of chemistry involved in precipitation. And so we can only go so far without eliminating part of our ions. So in this case, we just have to deal with the ion suppression that's present and try to move forward and do a study in which we can at least understand whether or not we can detect from a bone matrix. So we look at the limit of detection in the other matrices that have been used by LC-HRMS, and the references are listed here, from nail versus hair versus serum, urine, and bone. We can see that we have pretty wide range where IMPA would be about 7,500 picograms per mil and 20 picograms per mil in bone, which is what we're studying. And this is our limits of detection that we've determined. So we generally have fairly good limits of detection for every other analyte except EMPA. Again, that's our earliest eluting species, and it's going to have the most ion suppression and will probably have the least detectability. So at least we know that. So if we don't detect it, we know we might be below a certain level, below 350 picograms per gram, and so that might tell us a little bit about the species, a little bit about the individual, but not everything present in this sample. So let's move on to sample analysis and testing this method with a set of real samples that we were able to obtain through the U.S. Army collaboration and through a study that they did. And so they had a small study in mini pigs where they analyzed, they gave a dose at a certain amount of weeks, and you can see the dose listed for each of these each of these individual animals, either a transdermal or intramuscular dose was given. I'll note that in the dermal cases, we had about 6 in the dermal and 6 in the intramuscular. 2 of those that were given the dermal dose died overnight post-exposure, so they had a very toxic effect. The other ones were euthanized, and those were then, samples were collected from all of these individuals to try to help understand and see if we could detect the bone from this, detect chemicals in the bone from these different treatments. And this is an example of what the bone would look like. This is cut down into smaller pieces and then pulverized into this fine powder. And then each one of these samples is then extracted. Of course, they're randomized so that the individual we didn't know this up front, which ones got which. We just did the extraction and did the analysis in the background. So let's look at some of the results. And so this is to confirm that we have a real method. We have a negative control always and a positive control to know that this is what's happening. And this is an SRM method now. And so looking at the quantitative SRM performance, we can see that we can detect at least down to 750 picograms per gram as our positive control within this sample. So then if we look at all 12 samples together, we have in green those that are dermal and in yellow those that are intramuscular. And the two animals that died overnight, we get a very strong response for EMPA in this sample. The other ones we have a little bit of a response, but probably not enough to call it as a strong detected species. And so the great thing is is an SRM method. We always have qualifier ions and quantifier ions. And so you have on the previous slide, these are quantifier ions. And then we have the qualifier ions. And so we get confirmation that 1 and 6, those that died from acute exposure and acute response, definitely were positive in this bone matrix for what would be present. And we can call this as this would be a reason why they had passed away. Because and why these two, I don't know exactly why these two would have had this effect. Could be they metabolized it faster. It could be the exposure was slightly different based on that dermal approach, but we don't know. But at least we know that we can detect and confirm that it was present based on those two samples. And so what we also can measure is we can measure the type of bone, and we can measure the ratio in that type of bone, and that ratio can tell us a little bit about the toxicity performance and why toxicity would be there. There's a lot more work that needs to be done on this to really understand what that ratio means. If we don't, so this is just really showing you that you can start to do these calculations and then maybe make an assumption between 1 and 6 they had a higher ratio, and so maybe that ratio, a lower ratio, and maybe that tells us a little bit about toxicity. And 2 to 5 didn't have have a slightly different ratio, and so that might give us some inclination as to what's going on from a biological perspective. But again, more work will need to be done to confirm that. And you can sort of see that as I click along, the blue versus the red. It tells us that ratio difference is really something that we're going to tease out and try to think about more ways in which we can use this information to help understand the biochemistry that's happening. So Katie wrote an excellent method development article about this to show you how and all the whole process that went through, and in more detail the methods that go into this. So I encourage you to go look at that method, review it, and ask any questions that you might have about what happens and how you can detect weapons from chemical weapons and nerve agents. It's a very intriguing article, and the previous review article also has a lot of information about what might happen if we can start to do more scale-up screening, especially in places like Syria, where we had a potential chemical attack, but we don't have any way to confirm that. If we could allow a forensic anthropologist to go in, collect a little bit of samples, we might be able to confirm this kind of scenario. So as a review, we developed a model to understand incorporation of toxic substances into bone. We developed an instrument method and sample preparation methods to go along with that. A lot of validation went in this, and you can, again, review that article in Forensic Toxicology to get all the details that went involved. We were, in the end, able to analyze samples from mini pigs exposed to nerve agents and found that EMPA was found in multiple samples using this triple quad approach. And this would really represent the first time that this kind of exposure has ever been detected in skeletal remains. So it represents, hopefully we think, as a good future forward for analytical chemistry and forensic toxicology and forensic anthropology. But beyond that, there's also potential that maybe this kind of analysis in bone would be important for understanding maybe cancer therapies or understanding osteoporosis medications. So it's interesting to note that in the early 1940s, one of the first cancer therapies was based off nitrogen mustards, and that's chlorambucil, because it has a similar structure to that. It was developed based on that structure that had developed in the 1940s, and it's been used to treat leukemia and non-Hodgkin's lymphoma for over 40 years. One of the side effects of it is bone marrow suppression because of this rapid cell turnover. Nothing's really been measured in terms of what happens with the bone itself, but it's possible that there could be some hydration into the bone causing this kind of change, and maybe understanding that might help us understand efficacy. And of course, cisplatin and carboplatin also work in a similar to mustard gas. And I already talked to you about organic phosphate pesticides, so this could be one case where we could measure organophosphate pesticides in death cases to try to help understand whether or not that could have contributed to the individual who passed. Or in general, when studying maybe a new drug or a drug that affects your bone, maybe measuring what happens in the bone chemistry will help us understand how the efficacy of that drug is. And that just shows the structure of chlorambucil. So with that, I'd like to acknowledge the tissue that we had. We actually received a lot of donor samples that was from a company here that uses bone to help grow new material, and so that we were able to use that as test subjects. We had a lot of help in the forensic labs as well as in the clinical lab. Dr. Garganta, Dr. Chronister, Dr. Curtis, Dr. Stickle, Amanda Reeves, and Final Patel, as well as Dr. Rudolph Johnson at the CDC. And we also want to thank Todd Myers and Kimberly Witten, Bradley Bergen, and the USAMRICD for providing the samples for this mini pig study that we were able to use and test our method. I also want to thank the research funding. This was funded by the University of Florida Department of Anthropology, as well as the Maple Center for Forensic Medicine, the Forensic Sciences Foundation, and the American Academy of Forensic Sciences and Humanitarian Rights Resource Center. And I'd also like to thank Agilent for providing the seed instrument for us to do this work and for working with us to help think through the process of method development and help use the technology the right way to solve this important problem. With that, I'd also like to thank you for your attention, and if you have any questions, I'll be happy to answer. Thank you.
And thank you, Dr. Garrett, for that informative presentation. And we will now start the Q&A portion of the webinar. If you have any questions you'd like to ask, please do so now. Simply click on the Ask a Question box located on the far left of your screen. So let's get started. We already have some great questions coming in. We encourage you to add some more. Dr. Garrett, our first question from our audience member is, you use a combination of high-resolution mass spectrometry and traditional tandem mass spectrometry on a triple quadrupole. Do you think that the high resolution can also be used in quantitation instead of the traditional triple quad?
Well, Susie, thank you. That's an excellent question. The triple quad is a mainstay in the clinical lab. Most instrumentation there is used for quantitative analysis, so it's not going to go anywhere. But with the work we did, I think that high-resolution mass spectrometry will have a strong future in the clinical world, and I think it's for a couple of reasons. One, the dynamic range of high-resolution instruments is getting wider. So we're able to capture a larger concentration range, which is very important, especially in this kind of study. Sensitivity is getting much closer to those of a triple quad. The triple quad is still the most sensitive instrument that we have. And a second reason that I think is really important, we sort of showed this with method development for contamination, or for not contamination, but rather presence of citrate and other endogenous species that could interfere. And when using a high-resolution platform for quantitation, patient samples are going to be highly varied, and it could give us the opportunity to find patient samples that fail in quantitative methods, and we could dig into the high resolution information and find out whether a specific type of metabolite is causing that interference that may be present in only a subset of patients. So it might allow us to categorize a subset of patients that may fail for a specific reason and help improve the method, but also help improve our understanding of what's going on in the extraction and going on in analysis. So I think as high resolution platforms begin to be employed more and more, you'll see them transition into both quantitative and semi-quantitative approaches in a clinical setting.
Thank you for that. And we have one more question coming in. What was the most difficult aspect in method development for the study?
Yeah, so that's another great question. We spent a lot of time on this study in many different areas, and I initially thought that the chromatography would be the most difficult part. And I sort of talked about the decision between Hillock chromatography versus traditional reverse phase chromatography. And we had set out to do Hillock in the beginning, but we quickly found out that it just wasn't going to be as robust or reproducible for us in this setting. And so once we went away from that, the method development for the chromatography got more simplistic, and it was really more a matter of testing the different mobile phases. By far, the most difficult part of the study was the extraction. There aren't many methods out there for extraction of these species from bone, and even the extraction of these species from blood can be difficult at times. And bone presents a very unique kind of matrix that mixes between both solid structure, meaning very difficult to homogenize and grind to get a medium that you can extract from. So we had to optimize how you pulverize the bone, and different kinds of bone it will have different strengths, so that kind of pulverization might vary depending on the type of bone you're analyzing. And then we also had to verify all across the approach that the extraction from that kind of pulverized material would be a valid approach for doing extractions. And so we spent a lot of time testing different modes of extraction, testing different methods that would allow us to know that we're detecting what's there. And then once we get to that point and analyze real samples, the idea of ion suppression comes in. Because we're looking at polar species that are related to those that are present in the bone, like citrate, we have to optimize the extraction to maintain those species in the extraction, but also remove those contaminants. And I said citrate was one of those contaminants that was important. So the addition of sodium hydroxide in the extraction process helped reduce some of those salts, but we could never really fully eliminate them. So we still have to deal with the ion suppression, even in an optimized extraction approach. So I think as other people start to work on this and new methods come out, maybe that'll get better. But hopefully we showed you that it's even with the amount of ion suppression present, it's still possible to have a very sensitive method, a valid method, to analyze and extract and confirm that these are present, so that we can look in the future of new studies and hopefully gain some insight into more human-related interaction with this kind of species.
Dr. Garrett, thank you for your time today and for your important research. And before we go, I want to thank the audience members for joining us today and for their interesting questions. Questions we did not have time for today, and those submitted during the on-demand period, will be addressed by the speaker via contact information you provided at the time of your registration. And actually, we just had another question come in. Can we give you that one too, Dr. Garrett?
Yes, yeah, please.
Here we go. How often did you have to clean the MS instrument over the course of the study? That's a two-part question. And were there any concerns about the inorganic organics getting into the instrument, affecting the instrument performance?
Yes, that's an excellent question. And in the beginning, with the methods that we had a lot of contamination. So during the method development phase, we had to clean the source regularly, and that would be once a week or every couple weeks before we were able to continue to run, and we'd see a drop in signal, and we'd have to clean deeper because of that. After the optimized method, and the approaches for separation and removal of contamination, we found that we didn't have to clean it as often. So we went down to a more regular schedule of cleaning once a month or once every couple months, And so the method it still was able to run very, very robustly, not have to worry about the contamination over that period of time. And I think obviously we can get better at that. Of course, as you optimize the method, you have to test that long-term stability. And it's also, I think that's also an important question for anyone who's working with the method. It's important to know when to maintain your instrument to ensure you have the optimum performance. And you know, the use of internal standards is a key part of that. The use of course, knowing your lower limits of detection and having standards in there to test your lower limit of detection all the time, so that you know you're getting your instrument is an optimal performance, so that when the real samples come through, you can trust that results are going to be detected, or you can trust the results aren't detected too, and that's another key factor to think about. So thank you for that question.
And thank you again, audience members. And Dr. Garrett, thank you for this important study, and thank you to Agilent for sponsoring today's webinar. Again, any questions not asked to answer today will be provided via contact information you provided at the registration. The webcast can be viewed on demand through May 2021. Until next time, stay safe and have a great day. Bye-bye.
Thank you.